to begin our conversation, can you introduce yourself and how you got into being an advocate for autism?
Okay, hi. Hi, Rodney. Thank you. I'm Rosemary Laki. I'm a mom, a stay-at-home mom. I have 4 sons, all within the age of 12 down to 7. And my third son, Israel. Well, he's our special guy. Yeah. When he was younger, that's when how I became involved and started to learn more about autism was because of him initially not hitting his milestones at those critical times at around the age of 1. So because of him was the reason why I started to learn more and more about autism, and that's where my advocacy started when I saw the need in the system and the gaps in both in education and in the health to help moms like me and other families around the country who need these support services. So yes.
Thank you for that, Rosemary. When did you first realize that your child was at special needs? What were the initial symptoms, if I can put it that way, that alerted you?
Okay, when he was around, say, going towards a year old, we noticed that initially, I think when he was in his 9 months and all that, he would respond. He was responding to his name, he was saying bye, and where normal development of a child. But then as he grew to about a year old, it was when he stopped reacting. He wasn't making eye contact, not responding to his name, and no longer repeating words as children at that age would be doing. So that's when I knew there was a problem. Initially, I thought it was a hearing impairment, so I took him to the ENT at Homgen, and they did the assessments and they ruled that out. And then that's when I started to research more about it. His dad, Claude, and I were started to look more into what it could be. So the first signs that everything pointed, his symptoms all pointed towards autism. And he was still small, so we didn't want to label anything yet. But as he grew older, because of lack of communication, there was the other behavioral challenges that followed. And then that's when he ticked all the boxes that we were reading and researching about for autism. So yes, around a year old, I would say, yeah, going towards 2 was when we knew. Yeah.
You were saying when he was 1 going 2 years old.
Yes, yes.
I see. Were there any signs earlier than that?
No, like I said, when he was leading up to his before 1, he was already responding. We have videos of him waving back and we're calling him and he's saying bye, and then it just went away. So from there was when we started seeing the red flags and getting a bit worried. So yeah. So there's been a lot of self-research on our path, a lot of reading, a lot of, it's the technical age. So we jumped on the internet and got as much information as we could. And yeah, it all pointed to that. So
you mentioned you were afraid of putting a label. Is that something that prevented you from getting it confirmed, or it's something that you had to work through yourself and with your husband?
Sorry, Rodney, I think the internet connection's not that good over here. Yeah.
That's okay. That's okay. We'll work through these technical problems.
Okay.
I was asking earlier on. You mentioned being afraid to put a label to your baby at that time. Is that something that you had to come to grasp with husband before you told family members?
Oh yes, it's daunting for any parent, to I guess to think that your child is not typical and may need additional support. So in the beginning, we were just praying and hoping that he would just be like his 2 older brothers and that he would eventually develop speech. You would always have that hope in you, and you wouldn't want to come to terms. And I think that's something that I think a lot of parents may be healing and may also share those experiences early on. So we were trying to exhaust all possibilities before we could say yes. If it's autism, we knew that he would require a lot of therapy, and his conditions and symptoms maybe eventually may vary to being lesser, but still it would be more of a lifelong thing for him. So yeah, it was daunting. So initially we didn't want to label him until we were pretty sure. Yeah.
And that confirmation, was it from someone who was trained to assess children with special needs that you had to see for that to be confirmed? Can you walk us through?
Oh yes, we took him to PNG, Dr. Hagali, the child and adolescent mental health specialist. So Dr. Hagali, upon observation of Israel, she confirmed what we had already know, and also Israel's grandfather, Dr. Laki, he's also a pediatrician. So he also had initially confirmed to us, but said that you could see Dr. Hagali. She may have more experience in that specific area. So she also confirmed with us from observation of Israel. So yes, just a confirmation, but a full diagnosis we have yet to get for Israel, and that's where the advocacy comes in to try to help in that area.
I see. And that was when Israel was 2 years old, or a little older than 2?
Probably a little older. I think he may have been around 3 or 4 years old when he brought him to PNG and some psychiatric clinic here.
Nice. And how old is he today?
He's 9. He'll be turning 10 this year. Yes. Yes, he's a big guy.
I was doing some reading and I found out that there is not much health research around autism, either in PNG, Fiji, or any other Pacific Island country. In your own research, trying to access services, how big was that of a challenge?
Oh yes, it's a big challenge. It's right now we children with autistic traits are sent to the psychiatric clinic. But if you read up about it more in other developed countries, it's a developmental condition where initially a pediatrician will make an initial diagnosis of autism, and then if they develop other anxiety and all that, that's when they refer to a psychiatrist. Yeah. So yes, our health service, I understand the limitations and that it's very difficult for us to get past an initial observation. What next? We require therapy, a home plan, where a doctor can give us and say, okay, these are specific areas they can work on at home with your parents, and this is how your parents can support you. So those are the things that we are still hoping that through advocacy and more generation of our voices all around the country, we can start getting those services like speech therapy, occupational and therapists here to support our kids, to give us that support as well. So yes, we have very limited support in terms of the healthcare system. Yeah.
There must have been some cultural barriers in that you probably had to overcome. Can you walk us through with some of those barriers that you had to climb over in the context of, say, PNG, but I'm sure people watching from Fiji, Samoa, they will have similar experiences.
Oh yes, definitely. Well, we're very close to our community in Papua New Melanesian culture, so you have a lot of beliefs that it's a curse, and that you have all your family coming around trying to deduce where it actually came from, and that it's more of a spiritual punishment in some contexts and in some stories that I've heard as well. So yes, definitely those have been the kind of response we get in terms of our cultural understanding towards autism. So that's one of the sides of our cultural our culture coming into it. But another positive I've seen in PNG is we are very accepting. Everywhere I go, and I take Israel, and we may not understand social cues, so he might go and touch something that doesn't belong to him, or push a mother's table market or something, But when I explain, like, oh, he's a special boy, so and so, you have such compassion and empathy in our society. As a parent, where I've joined a lot of international parent support groups online for autism, I see a lot of a lack of that, probably in other cultures, more developed cultures, whereas I think our culture is very embracing, yes, and that's a positive part of it as well, yeah.
Yeah, you mentioned our belief systems sometimes tend to come to a conclusion as to a cause of a symptom or illness that we may be facing. Were you pressured in any way to take that route to see traditional healers, or how did you manage that with family and friends?
Well, for our case in particular, to see traditional healers, no, God, but we sought a lot of spiritual guidance through church and support in this area. But yes, definitely those discussions were had. We had those discussions around, oh, there's something wrong here, and we have to pinpoint, in our, culture and where it came from and whose side it is and all that. So yes, definitely we had those discussions.
Yeah, I'm sure our friends watching from other island countries will have similar experiences to share. Definitely when I was in Micronesia and now in American Samoa, I do get patients with such journey or experiences where they try out different things and then finally they come to the hospital. I was going to ask something about you highlighted earlier on, and that's the family support that we have. How important has that been for you, given our challenges in our health systems that we have?
Oh yes, family is crucial to this journey. To every family that has an autistic child, in our culture, we live in a communal surroundings. So having family there to understand his nonverbal cues, his quirks, his dislikes, his likes, it's really important. The support is invaluable. I think it's one thing that it gives a lot of support to us parents to yeah.
I'm interested also to maybe you can share your experience in taking care of a child with autism. What kind of training that you received, and from your journey so far, what would you like to say to moms, dads, parents, cousins, aunties who have someone in their family who has autism?
Oh, definitely. I think my message first and foremost is to understand how an autistic child thinks. Understand that every even if it's non-verbal, non-speaking, every action is communication. There is a reason behind why he may be doing something continuously, and although it's just so difficult for you to constantly bear, but there's a reason behind it. So I guess it's to learning more and more as we can. We were very lucky that in November we had an autism specialist pediatrician from Malaysia who was in Papua New Guinea briefly, and she ran a course, the SPELL framework, understanding and responding to autism. It's developed by the Autism Society in the UK. So it was mainly best practice standards on how to create a conducive environment for your child. So SPELL stood for structure. It's important that they have structure in their days, so there's lack of anxiety, because a lot of times they don't know what's happening next. They're worried and they become anxious. So structure is predictability, and it gives them that safe space. S is for structure, P is for positive approaches and expectations, not to put unrealistic expectations on if we're potty training them and it's taking a while, but they're moving very slowly just to have expectations that it will take time, but patience is key. And E is for empathy. It's always important to understand and have that empathy. I think it's something that a lot of autistic families and a lot more the siblings, they tend to grow up to be very empathetic people. Empathy is important in understanding in the why they do what they do and how they are communicating their needs. Empathy and low links, low arousal. Autistic kids or autistic individuals rather tend to be sensitive to a lot of it varies in each individual autistic person, whether it's lighting or different sounds. For instance, my son, he can't stand the beeping sounds, any beeping sound really. So we live next to a big shopping mall, and the trucks that come and unload, they're always reversing out, and he can't stand that. So we to get him noise canceling headphones. So there's low arousal because then it agitates them, and then they can have meltdowns. So low arousal. And links is the last L. Links is important where the whole all people around the autistic person, whether it's the school, the doctors, and the parents, we all are connected so that we are helping him or each individual where they are in progressing. And we all like it's more of like you have a clinic book, and then it moves around from the teacher to the doctor and the parents, all sharing notes on how that particular individual is progressing. So yeah.
Thank you for sharing that insight. Is Israel in school?
He was in school at the Kalan Inclusive Education Resource Center. They had I think the only one in the country, a specific autistic class. I think there's one other one now, but yes. He was in school, but then he started to develop a lot of sensory incidents, episodes where he was getting a bit more getting into meltdowns because he was irritated by tactile and different sounds. So I've kept him for now until we have to work through that, because at the moment, if we have that kind of understanding with teachers and all that, then it would be easier for me to leave him in the classroom. But because of teachers and schools, we still have to develop this kind of understanding. It's best I have him here with me at home. Yeah.
So I guess one of the gaps we have is teachers need special training to teach kids with special needs.
That's right. Yes, I think it's very important. The Catholic nun, Sister Shiny, who was here, was probably the only one. So she would give like little in-service to other teachers in the other special needs schools, but she's left the country now. So we've done one training, but we hope to do another training in spell again for more teachers during the year. Yes.
Thank you, Rosemary. I have seen a lot of photos of your advocacy work and what you are doing right now. Can you share a little bit of the work that you are currently involved in, trying to get the message out to the public, to government agencies, development partners?
I think the most important thing after the spell training, we had a parent meet information session. Dr. Zahira was still here, and we had that, and then we had an autism clinic. That was when she briefed our pediatricians briefly on how to do a diagnosis. We had a lot of media awareness. And this year we plan to do a lot of community outreach in the community, talking about autism, what it is. I think there's a lot of people in the community who know of an autistic individual, but many don't know the actual term, what it is. They might define it as a mental illness and say, oh, that, we talk long so that's it. But they need that more understanding on how to reach the autistic person. So I think that's a lot of our work this year will be around community outreach, speaking at school news to parents or wherever anyone would like to invite us to speak about what autism is and how our individual journeys and with the training that we've received and how we're implementing it at home and so on. And also we are looking at for this year to have more trainings, like we said, later on in the year, medical professionals, teachers, and parents.
I see. And you must have connected with families who are also have someone with autism in their family. What has been the response like when you call for meeting and conferences?
That's right. We just had our first meeting for our association. We're still almost finalized our registration of the PNG Autism Advocates Association. So I have a group of, for now, we have just a group of 12 people where we're building up our association, but we have hundreds of parents out there. Every day I'm getting messages and calls coming in from all across the country, and people and mothers, desperate parents needing help. Yes, so it's a real desperate situation for many, as they just don't know what to do. They can't understand their child. They don't know why he's crying all the time, but there's definitely a reason, but they can't reach him. Yeah, so that's my message would be that we need to keep working with our stakeholders, community development, health department, education department, to really create that environment where developmental conditions like autism, dyslexia, they're called neurodiverse conditions are really incorporated into their planning, so that we are not left out, because currently many of us, we are all left out of the system. Yes.
Yeah, thank you for highlighting that, where you mentioned that this special group of people are not captured within the current systems that we have. And thank you for coming out, sharing your story, and you kind of starting the spark that we hope will continue to be a snowballing effect around PNG, and getting more families, mothers and parents together. And I think one of the questions that I wanted to ask you, if you were to have a one-on-one meeting with Prime Minister James Marape, what would be your message to him regarding autism?
Oh, inclusivity, that would be my number one topic with him, because when we talk about inclusivity and disability in PNG, we only talk about maybe sign language, yes, and ramps for wheelchair users, and all those are very important, but not lots of people know about the invisible disabilities. So we want to be included as well. There's a lot of I think there's a GEDSI policy or GESI policy, social inclusion. We want to be included in that inclusion too. So that would be my conversation with the Prime Minister, that all around the world, autism is a very pressing issue, very pressing. And governments, Australia just launched their national autism strategy just last week, their first ever national autism strategy, because of the growing need for more services for the autistic population. And we are no different. We have a large community, and we would all really seek the government's to be included in government services here. So inclusivity would be my main topic with the Prime Minister, if I had a conversation with him. Yeah.
Let's hope either him or one of his officials will watch the video, and you'll have an audience with him.
Yes, yes. I'll put my phone number down.
How can people get connected with you, and to increase your network, and how can people help you with the kind of work you are doing?
Okay, for now we have our Facebook page, PNG Autism Advocates. They can message the page. Our Gmail, pngautismadvocates@gmail.com. And I'm also on LinkedIn, Rosemary Laki on LinkedIn. So that's where I advocate through the professional network. And how to help. Okay, for now we are getting ourselves all formalized, but how to help, I think we need a lot of our voice in the community. So if anybody has probably a school, a church group, anyone there where they can identify as being maybe autistic. Autism is a person who may have difficulty in communication and social interaction. So maybe they would like us to speak to them one-on-one with parents on how to understand the kids. A disclaimer is that we are not trained professionals. We are parents, and the doctors may be a bit more better placed at that, so they can also make their way to POMGEN, to the psychiatric clinic for now, and then speak to the doctors there who have attended the training as well. But the advocacy group, the parent group, we are there to assist in any way we can in terms of sharing positive information about understanding our children. Yeah.
Thank you, Rosa. I will put your LinkedIn profile link and Facebook page group in the description of the video when it's uploaded. So thank you for that.
Oh, yes.
Is there any other final things that you would like to say to viewers, not only in PNG but to the broader Pacific?
I'd just like to say that autistic individuals are different and not less. Many times, initially, before me learning a lot more about autism, maybe I was guilty of treating my son a little bit less. And now that I've got information, for those who are in countries where there's lack of services for parents out there, I would have, my advice is to, everything is now accessible. So to constantly learn and read. That has really broadened my understanding, and I hope that well, through that I'm helping my son. We're not there yet, but we keep going, and every day is an opportunity to grow and to just love and understanding to our kids. Yeah.
Thank you. Yeah, your Rosemary, your story, I think it's creating waves. We hope that small waves will become bigger waves, and what you are advocating for will catch on, not only in PNG but will spread around PNG, get our leaders involved, and also within the wider Pacific, because it is also and like you mentioned, an invisible group that their voices are not heard and they're not included in service planning, and especially giving them life skills, education, so they, as adults, they can live a normal life.
Yes, that would be really good. Thank you so much, Ronnie. On behalf of myself and the other parents in our association, PNG Autism Advocates, because we had our meeting and I told them that I would be talking with you today. We're all very grateful for this the coverage and giving us this platform to share our message. Yes, thank you so much, Robin. Really appreciate it.